So in 2008, last year, before you were riding this town motorbike, were you riding a motorbike at all?
Yes, I was riding a motorcycle.
And what was it? What was its condition like?
That's quite different because after having training with riders, there's a big improvement.
Yeah.
Just like the minor maintenances I was able to do. But before, I cannot do all those minor maintenances. You see.
So you just the bike.
Now and then I have a confidence. On riding.
Okay.
Because I have
you know what to do.
Yes.
Yeah. So you hadn't had any training beforehand.
No.
You just taught yourself or had a friend teach you.
Exactly.
Okay. And during your time as an outreach worker, have you ever had a period of time when you haven't had a motorbike?
Yes.
So what was that like, that experience?
It was because I was not able to achieve.
You couldn't just.
No.
How did you get?
Because sometimes I need to go to the communities, do community work, but there was no motorcycle.
Yeah.
So.
How long was that period of time when you?
It was almost 3 years.
3 years.
Yeah.
And so, how did you visit these communities at all? Did you use the ambulance, or did you go by foot or by bicycle?
No, sometimes before I used the ambulance. That was maybe Saturdays or Sundays when there is no RCH. Then I used ambulance. So it was not. I was not able to achieve.
So now that you have this town motorbike, you can see all these villages.
Because sometimes after the RCH, I can even go on community screening. That is after 2 o'clock. I can use my motorcycle and then go to the villages. And then even supervision of the community health workers. I can even go around 5 o'clock in the evening, go around and then see some patients, follow up.
So you've seen big changes?
Yeah, there's a big changes. There's a big changes. Even at help, even in terms of the ambulance and then these vehicles. You see, sometimes before the riders felt, sometimes clinics are cancelled. Sometimes the vehicle has a breakdown issue. For example, here, the vehicle was off the road for almost 5 months.
The ambulance?
Yes, it was off the road for almost 5 years. We have to go to the village, sometimes get a motorcycle and go on RCH. And then sometimes RCH clinics are cancelled because there is no fuel. But since then, now, sometimes the patients, the relatives have to buy fuel to transport their patient. And now that is no more happening. Now there's no more happening.
That's good.
Anytime you have the ambulance, the service is always here. The RCH, now, you see, there's a big change. Even if you go to, maybe at the end of this, because every we combine, you see, our records, you will see a big change. In terms of coverage.
Great.